So FDA found that there was a quite high rate of complications with placement of mesh and mesh kits, and they included erosion, pain, dysparenunia, which is pain with intercourse, bleeding, and extrusion of mesh or expulsion of mesh. There are cases where patients actually develop worse incontinence after mesh, and it could be either the overactive bladder type of incontinence, which is the urgent incontinence, or overflow incontinence. When the mesh is placed too tight and the patient can't empty her bladder gets so full at some point that it just starts leaking. So that's the overflow type. There is a group of patients that have something that is called dysparenunia. Dysparenunia is the pain within intercourse that the partner feels, not the patient. So with the mesh being rigid, it is sometimes the partner that will say that he has a discomfort, not the patient herself.
Of course, pain seems to be a predominant problem with this. Can you talk about the pain generators from the mesh?
Yes, so I believe that patients that have pain that developed after mesh, it could be caused either by erosion, but again, that's fairly simple to address. Pain may also be from the spasm of the pelvic floor muscles that surround the mesh, and I think that's probably the biggest group. And then the third group are the patients where the arms of the mesh are close to the nerves or nerve endings, and they either physically damage the nerve by literally going through the nerve, or they're in the close proximity of the nerve endings, and they basically pull in the area and cause pain.
Tell us how the mesh can contract and in itself pull tissues that could cause compression. Is that a mechanism of injury?
Yes, so mesh does not necessarily have to go through the nerve. I think if it's in a close proximity on the nerve, it puts tractions on the surrounding tissues, which put pressure on the nerve. I also think that the mesh may cause just general inflammation of the tissue and bleeding in the area that may scar the nerve.
Tell us about the pain during sexual intercourse. What are the mechanisms of that?
So pain during sexual intercourse, also caused dyspareunia, can come from many different conditions. Probably the most common cause of pain with sexual intercourse is the spasm of the pelvic floor muscles. So the vagina is surrounded by pelvic floor muscles, namely levator, obturator muscles. So during sexual intercourse, those muscles are stretched. So if those muscles are in spasm and pain to begin with, they hurt even more during intercourse.